Thank you. Good afternoon, everyone. We are here today in Ahero sub-county. We are launching the 16 days activism against gender-based violence. Of course, we are alive to the fact of issues gender-based cases. We are also alive to the fact of issues gender mainstreaming in terms of leadership. So it is an event that will take place for the next 16 days within Kisumu County. Of course, we have other events within other sub-counties, but this is just for the launch. Then on 11th of December, we'll be coming to a closure of the same. Of course, we'll be able to put into task all the CSOs, all the government institutions, the non-government institutions, in terms of what have we done within the 16 days that we were given to ensure that at least we do sensitization, we are able to enable people know how we can handle issues SGBV. So that is the main reason why we are here today. We are just launching the 16 days and to start the journey to walk through Kisumu County as a whole in all the 8 sub-counties that we have in Kisumu County. It is also important to notify the public at large that we'll be having our CSOs who will be having activities within each and every sub-county within Kisumu County. So dates are different, and I want to encourage the public to kindly join us when we do these activities. So we are here today with the Gender Sector Working Group within Kisumu County. All of us have come on board, and we are here to ensure that we deal with issues gender-based violence and we put it to an end, especially the triple threat, issues of early pregnancy, issues of HIV. How do we put our heads together to ensure that we put them to an end? Thank you. There is a policy that was passed in 2019. Of course, we did review for the same policy, and currently we are working with our local partners, the CSOs, the NGOs around, to make it to be a bill so that it can give us a formula of implementation. So of course we have, but we are working on the bill so that we can implement it fully with the support of our partners within Kisumu County. We also have the gender mainstreaming policy that talks majorly on, in terms of leadership, women in decision-making positions. Again, on the same policy, we are working on to make it a bill so that we are able to implement it as a county with our local partners. Yes. So maybe I'll give it to one of
violence. My name is Isto Cage, and I work with Kenya Female Advisory Organization, Kefiado, and we are a member of the Gender Sector Working Group. And one of the things we are looking about the issues of GBV is that there's been an increase on GBV, particularly against young people, adolescents, and at also different levels. And currently we know that government is also looking at the issues of the triple threat. And the triple threat is that GBV, particularly amongst adolescents, the issues of the pregnancies and the issues of HIV. So if you're not able to speak about the triple threat, then we still have high levels of lack of engagement with adolescents. And it is also important to look at the service delivery within the sector, and how then there's linkage between the rising cases of GBV and the service delivery within the health sector. And I know that Kisumu County has worked a lot on ensuring that the sub-county facilities have GBV units, and how then to ensure that we operationalize the GBV units to be able to respond to the cases at the lower community level. So that is also what will help us address the issues of gender-based violence at the community level.
Coordinator, Kenya National Commission on Human Rights. We are here today to celebrate this particular day, at the same time to create awareness, the members of the public, with regards to SGBV and need to support women and girls in our community. We have seen the county and the national government, they've put in place measures to try and address SGBV, including legislation, putting up institutions, but we are still seeing increased cases of SGBV. I would give an example. If you go to hospitals and see the number of SGBV cases reported and go to courts, you'd see the number dwindling. So that shows there is a big problem when it comes to multi-sectoral approach. No institution alone in the country, in the county, is able to address these issues. I know the Chief Justice a few months ago was in Kisumu to launch the SGBV court. That is a good step towards addressing this issue. But as a commission, in as much as we are looking at ensuring victims of SGBV receive justice, we are also advocating for prevention. That is why this year's theme is very important. We need to go back to the grassroots, engage our children, our leaders, stakeholders, so that we do not have cases of SGBV in the region. I may not have the actual statistics now because different stakeholders have different data, but I know for a fact if you visit a health facility, the numbers are higher compared to those that are in court or persons serving sentence in different prisons. So that shows there is a gap. But even if you go back to the community, the information chiefs have is again higher. So there is definitely a gap in terms of access to justice and the referral pathway. So we need to strengthen the referral pathway, at the same time ensure that that referral pathway not only engages in ensuring victims access justice, but also the prevention mechanism. Yes, the police, we do engage in trainings, and as a commission, they are part of our referral partners. When victims come to our office and they are not able to access justice, we engage the police officers. And I know as a unit, the police have also done great work in terms of coming up with gender desk. And I know we have different counties where we have polycare. This is an initiative by the National Police Service where they have put a one-stop center for victims of sexual and gender-based violence. So what we need as a country is build on the synergies as opposed to working in silos.
My name is Collins Kodek. I'm the convener of the Social Justice Centers Working Group, Western Chapter, and Kondele Social Justice Centers. This day is important for us as actors towards total elimination of gender-based violence, and of particular concern, this day also reminds us to begin thinking about domesticated approaches away from the global interventions and global reports. We need to begin asking ourselves, what are the local reports and what does this mean to the livelihood of our people? Importantly, we are also looking at how do we dismantle stereotyping of GBV interventions that brings about a binary divide of men against women. How can we have a common front which considers the realities that even though men have been labeled as perpetrators, but they are also victims of a system. We are also here to question systematic failures and not just programmatic failures. Systematic failures in the sense that men and women are both victims of a collapsed system which puts a lot of pressure on them and in a way exacerbates gender-based violence. And I think that's our message. We hope that in the next convening, we will not just come to celebrate, but we'll also be able to say what our approaches have achieved, because doing the same thing the same way all the time does not yield result is meaningless in our interventions. Thank you very much.
And more important is we have several pillars, but we realize that without the involvement of the male persons, because they are the majority perpetrators of gender-based violence, we will not be able to fight this war. And therefore, we have a pillar called male engagement and inclusion. That pillar is very important because it involves discussion around men. How are men felt in the community? How are they involved in issues that affect our community directly, whether it is socioeconomic, whether it is leadership, whether it is issues of culture, whether it is issues of property distribution and so on. So we realize that a male person plays a bigger role in the community, and therefore issues of GBV, they must be involved from the word go, so that we can all together fight GBV as a community without exclusion. And that is why when we are here to discuss that. We are here to tell the community that we need to talk as a team, not women on their own, men on their own. We are here to include everybody in our discussion, in our talking, so that at the end of the day, whatever kind of GBV that is there in the community, we are able to fight it as a team and as a voice in the community, and not a profiling element where men are said to be the perpetrators and women are the victim. We are here to say it is a voice in the community, and all of us should be involved in the fight so that we end it as a team. Thank you.